Hi, and welcome to the Good Health Podcast. I'm your host, Nicole Good, a registered nutritional therapy practitioner and functional medicine practitioner. Join me as we explore thyroid, brain, and fatigue conditions with positivity. From Hashimoto's to multiple sclerosis, chronic fatigue to adrenal dysfunction, I've got you covered. With expert advice and tips to help you take action now and inspiring real patient stories from successful individuals who refuse to let their health hold them back. Start your journey to good health today. And don't forget to come and join the conversation on Instagram at good_health. That's GOODE. Or visit my website at nicolegoodhealth.com to find out more. Welcome back to part 2 of answering your questions on longevity, chronic fatigue, and fatigue-related conditions. Last week, we were talking about longevity, we were talking about stress management, and we were also starting to look at those fatigue conditions around POTS and dysautonomia. This week, we're going to dig a little more into the dysautonomia conditions and also into chronic fatigue, answering questions that you have sent in. Let's jump straight into part 2 of this episode. Okay, so the next question that's come in is from Francis, and it says, how does stress affect conditions like POTS or chronic fatigue syndrome? Are there any good strategies for stress management you would recommend? We talked a little bit last week about stress management, but specifically the effects of stress for POTS and chronic fatigue. So we have to think about autonomic dysregulation. So both POTS and chronic fatigue patients can have dysregulation of the autonomic nervous system. So this is the part of the nervous system that controls those functions like heart rate, blood pressure, digestion, anything that happens automatically. So stress activates the sympathetic branch of the autonomic nervous system, so the fight or flight response. And that leads to increased heart rate, blood pressure changes, and other symptoms that can be characteristic of sort of POTS or chronic fatigue. So we've got to think about that autonomic dysregulation when we're thinking about how stress might impact these conditions. We also have to think about inflammation and immune dysregulation. So chronic stress triggers an inflammatory response in the body, and that can exacerbate symptoms of chronic fatigue or POTS and contribute to that immune dysregulation. And inflammation really is thought to play a role in the pathophysiology of both of these conditions. So we've got to think about it in terms of the immune function. Also sleep disturbances. So stress can disrupt those sleep patterns, have that poor sleep quality. That is obviously going to exacerbate fatigue. And both of those conditions really have fatigue as one of the primary symptoms. So lack of that sort of sleep can really worsen those symptoms and decrease that overall sort of well-being with those conditions. Stress also leads to muscle tension and increased sort of perception of pain. So if you've got chronic fatigue, or POTS, you can get that stress-induced muscle tension. And that really is going to make any pain or fatigue that you've got worse. So it really is important to manage stress with these conditions. This doesn't mean a lot of people worry that you're saying that I think maybe because with these conditions, people have often been down a road of not struggling to get diagnosis, not sort of knowing what is going on for them. And quite often they may have had somebody say to them, oh, it's probably just stressed or, something like this. So when you mention stress to people with these conditions, sometimes they can be a little bit concerned that you are putting it down to stress. And certainly in functional medicine, that is not what we're doing at all. We're not saying that these conditions are just stress or that they are even just caused by stress. It may be a part of the picture, a part of triggering a worsening of symptoms, and therefore stress management is a really good way of helping. But we're not saying that you are just stressed and this is the only picture. Stress is one part of the picture that we need to work on. And then you ask about the strategies for stress management. So quite a lot of the things that we talked about in part 1 of this episode. So, mindfulness and meditation, mindfulness practices, deep breathing exercises, they really help to reduce those stress levels, promote that relaxation. Mindfulness can really help you to focus on the present as well. So if you're having any anxiety and worry with being ill, that can be really beneficial. Progressive muscle relaxations. So this is where we systematically tense and relax different groups of muscles. We're usually working up from the toes all the way up to your head. So you tense one set of muscles and then you release them, and then you tense the next set and release them. Again, regular practice of that sort of progressive muscle relaxation can be really beneficial as well. It also help if you have that sort of muscle pain or muscle tension that can be associated with chronic fatigue or POTS. Yoga is a great one as well as getting you exercising. It's got those physical postures, but it also incorporates those kind of breathing exercises and meditations. It really helps to promote that relaxation and reduce that stress, especially if exercising may be difficult for you if you have POTS or chronic fatigue. So yoga, gentle yoga practices with breathing, thinking of it as stress relief, can be a really good way of just getting your body moving as well, rather than thinking about sort of doing heavy exercise. It can just be a simple stretching kind of relief that just is going to help again with that muscle tension if you have any of that, but also just in terms of helping you to get back into a little bit of exercise and get moving without having to do anything too intense. Regular exercise, again, really good, but not easy for everybody. And I appreciate that. But simple things, walking, swimming, the gentle stretching that we just talked about with the yoga, all of those help with stress. So any exercise is going to help with stress, any movement. I always say with these conditions, think about it rather than exercise, think about it in terms of just movement, moving your body. What can you do that just stops you sitting in a chair, that just gets you moving? Keeping things really simple, but that's going to help. Healthy lifestyle habits, healthy nutrition habits. So really just eating that balanced diet, getting some regular movement, prioritizing sleep, avoiding those excessive, processed foods, caffeine, alcohol, all of those things really going to help with reducing stress. Reaching out for support as well. Some of the talking therapies, there's lots of different therapies that you can look at. EFT, tapping, there's lots of different things that can be beneficial in terms of alternative therapies, and looking towards those as well to help with stress can be really helpful. Social support as well. So this is another of my 4 lifestyle S's, social, really important to have that in your life. So connecting with family, connecting with friends, even support groups. If you feel like you can't talk to your family or friends about your condition, or you feel like they don't understand, which I do have some patients say that to me, then, support groups can be really good at that point. They can provide that emotional support, or it might be where a talking therapy might be beneficial, but can help. Anything that helps reduce those feelings of isolation, lets you share your experiences, receive some encouragement. That's going to be really, really invaluable for managing stress. Thinking about time management as well and prioritizing things. I talk about this again in my upcoming book that's going to be released in November. We talk about pacing, prioritizing. So we talk about the 3 Ps, that's going to be in there. Learning to manage time effectively, prioritize tasks, break tasks down into smaller manageable steps, learn to delegate, learn to say no. All of these things are really going to help with that stress management. So there's lots of things there that you can really try and incorporate into your day-to-day life, into your daily routine to help with that stress. And that's really going to be beneficial for anybody who's living with POTS and chronic fatigue. So I hope, Francis, that helps and that gives you some ideas of some of the things that you could maybe incorporate into your life. And just remember, don't be afraid as well to reach out and seek help if you feel that you need it. There are a lot of good psychologists, therapists, counselors out there who can really help you with some of these things as well. Okay, so the next question comes in from Lucy. What diagnostic tests are recommended by you to understand chronic fatigue better? So diagnosing chronic fatigue can be really difficult. And this is something that a lot of people come up against. So a lot of people, when they do approach me, do want to know what diagnostic tests can be done. Really what they can do, particularly in functional medicine, we're less concerned with diagnosis and more concerned with root cause. So rather than looking actually at, have we got a test where we can really rubber stamp on you that you have chronic fatigue, we're more looking to root cause. That's really important to us in functional medicine. That's how we work. So what is going on in your body? What could be triggering these flare-ups of fatigue? Why have you not got enough energy? What's going on for you? So, really important to do that before we even get to the testing. Really important to do a detailed symptom history, really looking at onset of symptoms, duration, what was going on for you in your life at that time when symptoms started or just prior to them starting. Really looking at that really detailed health history. And we do that all the way back to childhood. And that includes looking at sort of, viral history and all of that sort of thing. Review of your sort of the systems in your body. So, what symptoms have you got? Are you experiencing the muscle pain, the joint pain, headaches, sore throats, lymph nodes, fatigue? What's going on for you, and what systems within the body do they relate to, and where might we be able to support those systems in order to help you get some healing and some care. Physical examination as well can also be important. So that can be another part of the picture. And then we can move into these lab tests that you're asking about, these sort of testing. So there's a few different things that we can look at. There's the standard sort of blood panels. A lot of the time it comes down to ruling things out. So things like your CBC, your complete blood counts, we're ruling out things like anemias, ruling out any blood disorders, because they can all contribute to fatigue. So we're making sure that nothing's being missed there. So you may find that if you've been to the doctor that's already been done. You may find that they've also done some of those metabolic tests as well. This is something that we use a lot as well in functional medicine. We look at sort of glucose levels, we might look at electrolyte levels, you might have your kidney or liver function tested. So all of these things are really beneficial. It's not so much about diagnosing, it's more about building a picture of what's going on in the body. So that's what we use these for. We're looking at ruling out the anemias, looking at how your kidney and liver function is, looking at electrolyte levels, looking at whether you have any metabolic disorders, thyroid as well. So commonly would look at thyroid testing. They can also cause fatigue. So we definitely want to make sure that we're ruling anything out, making sure that your thyroid hormone levels balance. I also would look at thyroid antibodies to make sure that there is no underlying autoimmune condition there that we are missing. So that can be beneficial. Looking at those inflammatory markers as well. So C-reactive protein, CRP, ESR, all of those things to see if there's any inflammation in the body. And then we can look at that sort of infectious screening. So we commonly, we know that Epstein-Barr virus is heavily linked to the development of chronic fatigue. So we can run testing to see whether you have current infection or whether you have had EBV and it's maybe reactivated, because we know that can happen. Some of the other viruses that we can look at as well, things like cytomegalovirus, some of the HHV6s. We also look at Lyme disease. So there's lots on the viral infectious disease sort of screenings that we can do. And then the other thing we might do is autoimmune markers as well. So screening for some of the systemic things. So some things like lupus, we might look for rheumatoid arthritis. And then we also have autoantibody testing where we can run it sort of around your body to see if there's any autoantibodies flagging up anywhere within your body that could be contributing to these kind of systemic symptoms that we see with chronic fatigue. So there's a lot of testing that we can do. It's not really about finding, one individual diagnostic test. It's about building a picture of what's going on in your body and what those underlying root causes are. And that's really the approach that we take with the testing for chronic fatigue. You may also find some of the things sort of a little bit outside of sort of the lab testing, things like you might find you have some orthostatic testing. So we look at blood pressure on being seated and standing. Some people have tilt table testing. So things like that, looking for that autonomic dysfunction, which can happen commonly, things like POTS and autonomic dysfunction commonly linked with that chronic fatigue. So if you're experiencing symptoms like the lightheadedness or palpitations, you might find that sort of thing comes into play as well. Some people have sleep studies done. So there's lots as well on the sort of outside of that sort of lab testing, sort of evaluations that can be done too. We can get really, really detailed. Mentioned already the autoantibody testing around that whole body. It's really getting very advanced with our testing. We can look at cytokine profiles. We can look at your natural killer cell function. We can look at adrenals as well. That's another one that I haven't mentioned. So we can look at that cortisol levels, look at your adrenal glands, see how they're functioning. And then we can start looking again a bit more to like root cause, sort of the gastrointestinal sort of things. So looking at comprehensive stool testing. Is there any dysbiosis? Is there any of that intestinal permeability or leaky gut going on? Are there any bacterial infections going on? So there really is so much different testing that we can do. And we would really make a decision on that based on what symptoms you're experiencing, potentially based on budget as well, because obviously this testing is not cheap. It's going to add up particularly if you were going to have everything done that I've just mentioned. It's really going to add up. So, it might be that we come down, you have a budget for testing, and then we would look at what would be the most beneficial for us to get back. But really, rather than looking at diagnosis, we really are looking at that root cause, and that really key when we're working with something like chronic fatigue or POTS. So I hope that helps answer your question. There really isn't that kind of, I know, Lucy, you may have been looking for kind of that one sort of diagnostic test, and there really isn't that sort of one thing, but there is a lot that we can do and a lot of things that we can look for and a lot of things that we can support you with. So I hope that helps you to understand the types of things that you could be talking to people about and asking for. Okay, next question is, and this is from a Lucy as well, potentially the same Lucy. What role do mitochondria health and function have with regards to chronic fatigue? Okay, so how are the mitochondria linked to chronic fatigue? So mitochondria are the powerhouses. I've talked about mitochondria a lot on the podcast. We have episodes sort of dedicated to mitochondria. They are the powerhouse of the cells. They're responsible for generating energy. So they generate it in the form of adenosine triphosphate, which is ATP. And that's the energy currency that your body uses for cellular processes within the body. So we need lots and lots of ATP. And I talk about this in my book that I've been writing recently. We talk a lot about energy and ATP and mitochondria. So if you want to read more on that, you'll be able to get your hands on the book soon. The connection between mitochondria and chronic fatigue, we're looking at that impaired energy production. So in people with chronic fatigue, we quite often see that ATP deficiency. So mitochondrial dysfunction that has led to a reduced production of that ATP. And that means that you just don't have that cellular energy that you should have. And that deficiency can really affect various organ systems. So it can contribute to lots of the different symptoms. So fatigue, muscle weakness, a lot of that post-exertional malaise that is really characteristic with chronic fatigue. So that's a really common way that mitochondria are linked in with chronic fatigue kind of directly. Then we also have sort of metabolic aspect to it. So dysfunctional mitochondria can disrupt the metabolic pathways that are involved in energy production. So things like glycolysis, oxidative phosphorylation. And that metabolic dysregulation can exacerbate the fatigue that you experience with chronic fatigue. So that's another sort of way that mitochondria are involved. Then we also have to look on the side of oxidative stress and inflammation. So dysfunctional mitochondria can produce too many of the reactive oxygen species. So this can cause oxidative stress. And elevated reactive oxygen species can lead to more cellular damage. So that's another way that they are involved. And we need good functioning mitochondria to keep that oxidative stress in balance. We also then have to look at the inflammatory response. So if your mitochondria are dysfunctioning, then that oxidative stress that we get from that, which we just talked about, can trigger an inflammatory response in the body. And chronic inflammation really is a classic feature with chronic fatigue and can contribute to lots of the symptoms. So fatigue, cognitive dysfunction, brain fog, pain, lots of different things can be linked to that inflammatory response. And we can get an increased inflammatory response if we have mitochondrial dysfunction. So that's another way. We also want to look at that cellular function. So the thing with the mitochondria is they really are involved in so much around the body, and they're also involved in your cellular function. So they're involved in neurological dysfunction. So they're in the brain, the nervous system very heavily. We have a lot of them in their cells in the brain and the nervous system, and they can impair neurotransmitters. They can impair the neuronal communication, so how your neurons speak to each other, and therefore your cognitive function. So classic symptoms around that is the brain fog and memory problems, that cognitive impairment that we see with chronic fatigue. Mitochondria can be playing a part in that. As well, on the cellular function side of things, it can be that muscle dysfunction. So again, muscles are highly energy dependent. We need energy for your muscles to work. So they are particularly vulnerable if you have that mitochondrial dysfunction. So impaired ATP production is going to lead to muscle weakness, pain, reduced exercise tolerance. And these are all things that people with CFS are struggling with. And then the mitochondria also are heavily involved in immune function. So there is no real simple answer to this. Mitochondria really are, really heavily involved. And they play a real crucial role in regulating your immune function, as well as that inflammatory response that we've already talked about. So it can actually, if your mitochondria are not functioning well, you can actually get dysregulation amongst immune signaling pathways. Therefore, you can get your immune responses not reacting well. You can get chronic inflammation, and all of this is observed again in people with CFS. All of that can mean that we can get what we call viral persistence. So there is research coming through now that suggests that mitochondrial dysfunction may impair the immune system's ability to clear viral infections. And we know that sort of persistent viral presence can be one of the triggers for people with chronic fatigue. So there's lots and lots of ways that mitochondria are involved. They are recognized as a key contributing factor in the pathophysiology of chronic fatigue. So if it is something that you are struggling with, Lucy, then definitely working on the mitochondria is going to be a really important part of the picture. Okay. So the next question is also on chronic fatigue. This has come in from somebody anonymous, so we haven't got the name for this one, and that's absolutely fine. By the way, if you want to send questions in, you want to do that anonymously, that's absolutely fine. So the question is, how do I know I have chronic fatigue, and what do I do if I'm struggling to get a diagnosis? Okay, It is notoriously difficult to get a diagnosis with chronic fatigue. It's a case of, as we've discussed, it's a case of ruling things out usually. The core symptoms that we see, severe fatigue, so unexplained, persistent or recurrent fatigue that significantly reduces your activity levels. Usually they say this is for 6 months or more. The other thing we're looking for with that is that post-exertional malaise. So the worsening of symptoms around exertion, and that can be physical or mental exertion. So it doesn't need to just be exercise. It can be around mental exertion as well. Unrefreshed sleep as well. So waking up just really not feeling like you've been asleep at all, even if you've slept for a full night. So that's something that we would look for. Cognitive impairment, so things like brain fog, these things are really, really important. And that orthostatic intolerance, looking for that. So anything like lightheadedness, dizziness, palpitations, feeling faint, all of those things are things that we would be looking for. So if you are recognizing those symptoms, then really important to go to the doctors and speak to them. They can run some of those tests that we've talked about in this episode, and see if they can rule out anything else. And then also it's really thinking about some of the other symptoms, because a lot of people think chronic fatigue is just fatigue, and it's not. There's a lot of other things that are going on. So things like the pain, we've touched on that sort of muscle issues that can be there with chronic fatigue, but muscle pain often is described as really deep aching kind of pain. We get joint pain with it, typically with joint pain. So if you want to try and recognize joint pain with chronic fatigue compared to other conditions, typically joint pain can migrate. So it can move different joints, different times. So you may have shoulder pain one day, you may have hip pain another day. So it's not like sort of injury or rheumatoid arthritis where the pain stays within the joint that you have it in. Often it can migrate to different joints around the body. So looking for that sort of thing is key for helping to get diagnoses. So you being able to really recognize these things in yourself is going to help when you go and speak to your practitioner. You can tell them these things, and giving them those indications that these things are happening. So, I've got my grade 3 joint pain can really help in speeding up getting that diagnosis. So it's learning and understanding these things so that you can inform the doctor really well of what it is you're experiencing. So other things, headaches as well. So either new or more severe headaches than you would get normally, often tension type headaches or migraines, quite common. So keeping a note of things like that. Recurrent sore throats without infection. So often there's not actually a throat infection there. So if you've been to the doctor a few times with sore throats and checked to see if there's an infection, there's no infection, but you keep getting these recurrent sore throats, that's a key indicator as well. Tender and swollen lymph nodes, so particularly neck or in the armpits, that's another key thing to look out for as well. And then those we call it like flu-like symptoms. So generally that kind of feeling like you're coming down with something is how we often describe it. Feeling like you're just starting with something at the beginning of being unwell, similar to if you were starting with flu, but you don't have the flu. So we can get things like low-grade fever, you might get chills, general malaise, so those sort of flu-like symptoms as well, looking out for things like that. Sensitivity as well to environmental stimuli. So things like being sensitive to light, being sensitive to sound, chemical sensitivity as well. So if you suddenly find that you can't tolerate smells, perfumes, chemicals, things like that, that can all be a sign of chronic fatigue. Sensitivity as well to medications as well. If you find that you're suddenly not tolerating medications well, or even supplements for that matter, that also can be a key sign to look for and can help in terms of getting a diagnosis. And then those gastrointestinal symptoms. So irritable bowel type things, abdominal pain, bloating, and then that alternating kind of diarrhea, constipation, or you may just have one or the other. Sometimes nausea, loss of appetite as well, heartburn, things like that. So all that digestive stuff as well, keeping a note of that. Temperature regulation as well. So if you find that you can't maintain a stable body temperature, you're feeling too hot, you feel too cold, you don't tolerate the hot or the cold well, things like that, that can all be part of it. And frequent infections as well. So feeling like you're catching colds and infections and viruses quite a lot. So being able to recognize those things. So if you really want to try and get a diagnosis, documenting your symptoms, looking out for all of those things and learning how to describe them in the right way can really help in terms of getting a diagnosis. So keep a detailed record of your symptoms. Think about their severity and how they're impacting your day-to-day life. Keep a note of that. Include those things like your sleep patterns, activity levels, anything that seems to trigger or worsen symptoms. All of that's going to help in terms of getting a diagnosis. make sure that you go through that comprehensive medical evaluation that we've talked about. So ruling things out. We want to rule out autoimmune disorders, anemia, thyroid, Lyme, sleep disorders, ruling all of those things out, really important as well. Seeking help from somebody who understands chronic fatigue as well. It is something that's becoming a lot more known, and people are becoming a lot more knowledgeable around it. But there are still some difficulties in people really understanding chronic fatigue. So if you feel like you've gone to a practitioner who is not understanding it, then really important to make sure that you find one that does. Learn to advocate for yourself as well. You need to be really proactive, learn about chronic fatigue, be really persistent in seeking help and getting that diagnosis. Get a second opinion if you feel that you need it. Consider sort of specialized testing outside of what you might get on the NHS as well. Look to things like functional medicine and some of the other alternative therapies that can be really useful. Joining support groups, for some people that works, for others it doesn't, but that can be beneficial for some. And then really staying informed, really learning, getting up to date with the latest research. If you find that difficult, find a practitioner who will do that for you. That's something that, I do with my patients all the time. I'm constantly learning, getting the latest research, learning about the new developments so that I can help my patients to understand that without them needing to do all the research. So if you find that difficult, getting help and support on that as well. So I hope that helps in terms of things that you can do and things to look out for. That's really key, knowing what to look out for. So I hope that's really beneficial. I've really enjoyed answering your questions in this episode. If you have questions that you want answered and you want me to answer on the podcast, I'm happy to do that. We'll do more of these episodes. You can send any of your questions into info@nicolegoodhealth.com. We will put the email address below this episode so that you can grab it there easily. Good has got the E on the end. Send your questions in and we'll do more of these and answer questions and get you the help and the advice that you need. Thank you for joining me on today's episode of the Good Health Podcast. We'll be back next week with a great guest episode. I hope you enjoyed this episode of the Good Health Podcast. Do share the episode with anyone who you think it may benefit or who may enjoy it, and help me spread the word by rating the episode or leaving a review. If you want more, you can find other episodes in the series on your podcast app or sign up to my free newsletter. Not only will you get information on new episodes launching, but we cover lots of health topics with the Ask Nicole section where you can send in your questions, my favorite recipes, my favorite products, tips and tricks to help you on the road to good health, and much more. You can sign up free of charge at nicolegoodhealth.com/newsletter, also linked below. I hope you have a lovely week. Don't forget to hit subscribe and I'll see you next time.